Hello, hello, my people. Good morning, good afternoon, good evening, depending on what time you're watching this broadcast. Welcome to Malaka Broadcast Network, a new health bulletin for this week. So, this week, we're going to talk about heart health. Do you know that the number one cause of death in America and most of the world is heart disease? So, in this month, especially here in the United States, we celebrate heart disease awareness month. So, today I want to talk to you a little bit about heart disease and how to optimize your health, what things you can eat, what are the best supplements for you to be able to have a good health, heart health, and why is that Malaka Broadcast Bro will do the health bulletin. Why? Because we are ambassadors. That means that we have work to do for the kingdom of God. And in order for us to do that work, we need to be healthy and we need to be strong and we need to be alive because otherwise we won't be able to accomplish the assignment that God has for our lives. Okay, and not only that, but we're not going to be able to enjoy the blessings and the rewards that God has for us in the kingdom of God if we are sick. Okay, or we die prematurely, we're not going to be able to enjoy that. People are waiting to go to heaven to be able to get all the rewards. You don't have to wait until you get to heaven. You want to get to heaven, yes, but you don't have to wait until you get there to start enjoying the rewards of the kingdom. You can enjoy it now. So let's start. So producer, can you put the PowerPoint right now, please? Okay, so today we're going to be talking about heart health, inflammation, and metabolic syndrome. Why those three topics? Because metabolic syndrome and inflammation are the precursors of heart disease. So that's why we're going to be discussing those, okay? So let me go to the next slide. Okay, so what do the Word of God say about us taking care of our bodies? The Word of God said in 1 Corinthians said, "Do you not know that you are the temple of the God and that the Spirit of God dwells in you? If anyone destroys the temple of God, God will destroy him. For the temple of God is holy, and you are that temple." So our bodies, people, are the temple of the Holy Spirit. Do you will introduce Jesus to come to your house and your house is all a mess and all destroyed and all dirty and clogged? No, you will not do that. You will invite him to a place that is clean and it's organized and it's beautiful and it smells good. So we need to do the same thing with our body because our body is the temple of the Holy Spirit. Plus, it's the only body that we have to accomplish the assignment that the Lord has for us. And also in Proverbs 4:23, the Lord says, "Above all, guard your heart, for everything you do flows from it." So everything that we do flow our heart. Now, when the Bible is talking about our heart, it's talking about our mind. So that tells you that mind health is very important for our physical heart as well. And all life comes for our physical heart too, because if our physical heart do not supply all the oxygenated blood to all the organs, we are dead. So you can see there. So as you know, the cardiovascular disease is the number one cause of death in America. They said that 1 in every 3 people. Okay, and I saw other statistics that said 2 in every 3 people are suffering of some kind of heart disease. So we want to stop that. We don't want to suffer a heart disease. And let me tell you something, most of the heart disease are caused because of our lifestyle. They're not necessarily something that we inherit or something that is in our gene. It's something that we are predisposed because of our lifestyle and the way that we eat and the way that we live that are causing heart disease. Okay. So let's talk a little bit about what is the cardiovascular system. The cardiovascular system is built of your arterial system. The arterioles, the arteries, are the one that carry the oxygenated blood, okay, through the whole system, to the whole body, so the cells can have oxygen. And then the veins are the ones that carry the deoxygenated blood, the ones that the blood that already the oxygen have been already used up, and they bring it back into the heart so the heart can pump it back into the lungs so the lungs can oxygenate it and then bring it back to the heart and it will go to the artery. So if you can see the picture here, you can see what the human heart look like. Okay. Okay, so what are the different types of heart diseases that we have that we can suffer? We can suffer coronary heart disease, and coronary heart disease, the coronary arteries are the arteries that fit the heart. Those are the arteries that bring the oxygen to the tissue of the heart, to the muscle of the heart. Okay, so those arteries can get clogged because of cholesterol. They can get calcium calcification, get hard, and then raise your blood pressure. So when you have disease of the coronary arteries, which is the number one disease of heart disease, then you can suffer heart attack. Okay, so that's one of the diseases that you can have. You can have heart valve. We have two valves in the heart. You have the mitral valve and the tricuspid valve, and those are the valves that are between the atrium and ventricle. The top chambers of our hearts are our atrium, and the bottom chambers of our hearts are ventricle. The ventricles are the one that squeeze the blood to the top atrium. So one of the sides will take the blood out to the body, and the other one will take the blood back to the lungs to get oxygenated. Okay, so those when there is a malfunction in the valve, or either maybe something congenital that happened when that you were born with a deficiency, or the valve wasn't constructed properly in during the growth in your mommy's womb, then you can have heart valve issues. What is a congenital heart disease? A congenital heart disease is a deformity, okay, or a lack of or any of the functions of the heart that happen from birth, that are caused from birth. So those are the congenital heart disease is the one that comes from birth, or maybe a disease that is it runs in your family and it comes in, but that is not affected by the lifestyle. I mean, it's affected by the lifestyle once you're born with it, and you want to make sure that you avoid exacerbation of that disease. Then your lifestyle come into play for that. But that's the only one that is not caused by your lifestyle. Then you have arrhythmias. Arrhythmias have to do with the electrical impulses of the heart. Okay, so arrhythmias can be like tachycardia, which means that you're having very fast heartbeat, or bradycardia, that you're having very low heartbeat. Or you can have atrial fibrillation, that is that you have some kind of blood is leaking through the valves, and you have flooding and they can see that in an EKG. Usually, when you do that, when you have something like that, then you need to take some blood thinner or something like that to help the blood not to clog because of the leaking of the blood when you have atrial fibrillation. Then you have heart failure. Heart failure happens when your heart can no longer pump. I'm sorry that my dog heard the doorbell and he started barking right now. So, for example, when your muscle heart, when the muscle of the heart is not working properly, and now the heart cannot pump enough blood to the rest of the body, that's heart failure. And then you have heart muscles, that's a heart muscle disease, like myocarditis. Do you know that there's a job out there that one of the main side effects is myocarditis? That right now there's a lot of people that got that job that now is suffering of heart disease and myocarditis, even young people. The other day we have a little kid, 10 years old, that passed away of myocarditis after a few days of having the job. Okay, so it is serious out there. So you see those pictures of blood, two blobs in the side here. If you look at the bottom one, that you see one that is clear and then one that is cloudy. The clear one, this is when I used to work in the lab. I took samples, and what I did is I put it backwards so you don't see the name of the patient. But I wanted people to see how blood's supposed to look naturally, and how it look when you have high cholesterol and high fat in your blood. So if you can see the one in the left that look sort of like urine, that is clear, that you can see through the tube. That's how your blood was supposed to look. When they test your blood, they separate the red blood cells. You can see the red blood cells in the bottom, okay? And they leave the serum. From the serum is where they do all the chemistries and hormone levels and antigen levels and stuff like that. All the tests are get done there. So imagine if your blood is this thick that you cannot see through. That means that it's thick and sticky, running through your veins, sticking to the walls, causing blockages everywhere you go. That's why you get circulation issues, you get cramps and things like that, because you have high cholesterol and high triglycerides, and that's how the blood look. Not pretty, huh? Not pretty. Go to the next one. So what are the symptoms of heart disease? Symptoms of heart disease, especially that you're going to have a heart attack. The symptoms are shortness of breath, fatigue, weakness, chest palpitation, dizziness, and cold sweat. Now, there's a difference between women and men. So if you can see here, for men, it will be the shortness of breath, the fatigue, jaw pain. They can have jaw pain, chest pressure, like you have a elephant sitting on your chest, for example, anxiety, back pain, feeling of fullness, like your stomach is very full, and nausea. On a woman, can be unusual fatigue, lightheadedness and fainting, discomfort in one or both arms, or in the shoulders, in the jaw, or in the stomach. Chest pressure also, like if you have somebody squeezing your heart real hard, or you have an elephant sitting on top of you. Upper abdominal pressure or discomfort, feeling of fullness, and cold sweats. So those are the symptoms. If you have any of those symptoms, go call 911 right away. Right away. If you are beside somebody that is having those symptoms, the first thing that you want to do is do chest compressions. You want to do CPR, that's starting with the chest compressions, okay? Now, what is the root cause of heart disease? The root cause of heart disease is chronic inflammation. So what is inflammation? Inflammation is the normal response that your body have whenever you get a cut, whenever you get an injury in your body. The white blood cells and the immune system will create inflammation into the area, meaning bringing more blood into the area, okay, and causing damage into the area just to make sure that the area heal. The area heals. But what happens is that when we have chronic inflammation, that means that cycle do not stop. So it's continuing to damage the area, because now it's supposed to heal the area and then stop when everything is healed. But when it continue to feel that there's something going on, and it continue to create the inflammation response, that now it's causing damage into the area. Okay, and that damage cause oxidative stress. And what is oxidative stress? Oxidative stress is every single thing that we eat, every single thing, that every metabolic processes that happen in our body, in our mind, in our thoughts, everything, our cells have to metabolize that. And when we metabolize that, it creates free radicals. Free radicals are negative ions that are by themselves, that don't want to be by themselves. They don't want, they don't want to be divorced. They want to get married. So they try to get into other cells to get that positive connection. And what happens is that they damage this cell to get to the other cell, and then the other cell get damaged to get to the other cell. And all that damage cause damage in the tissues of the heart, of the arteries, of the muscles, or and everything when it comes to your cardiovascular system, causing disease. Okay, and the longer that you have that inflammation response in your body, the worse is the damage that happen into your organs, especially when it comes to the hearts and to the arteries. The more inflammation there is in the arteries, the more cholesterol that can get stick into the veins, into the arteries, the more of the calcification that can happen, causing high blood pressure, causing rigidity, causing blockages in the flow of the blood. Okay, so those are things that we need to maintain down. We need to make sure that we keep our inflammation levels down. It's very, very, very important. Okay, and then what is metabolic syndrome? Once you have that inflammation going on, there are certain symptoms that happen that create the great picture, for you to get a heart disease. So what are those? If you look at the picture here, if you have visceral obesity, that means that if a woman have more than 35 inches in the waist, if the men have more than 40 inches in the waist, then you are at risk of heart disease. If you have insulin resistant, meaning that you're pre-diabetic, that means that you have a fasting blood sugar, okay, higher than 110, and a hemoglobin A1C, which is a test that tests your sugar, how's your sugar for the last 3 months. If you got more than 6.0, and a fasting blood sugar that is more than 110, then you are pre-diabetic. That means that you have an insulin resistant. What that means? That means that the insulin, that your pancreas is secreting the insulin is like a truck that take the glucose, the sugar out of your blood, and then take it to the cells. And then the cells have garages or pathways, doors, that then the little truck will park into the garage, okay, and then dump the sugar there. But when you have insulin resistant, meaning that there's damage because of inflammation. If there's inflammation, there's swelling around the cell. So the insulin cannot park. If there's oxidative stress, that means that the integrity of the cell is damaged. Now the garage doors are jammed, and the insulin cannot get in there. So you are not able to dump the glucose in there, so that you start having insulin resistant. And then the prolonged time of insulin resistant, then you will have diabetes. Another thing that will tell you if you have a metabolic syndrome, if you have low HDL, which means good cholesterol, and then high LDL, which is bad cholesterol. If your cholesterol is high, then you have a higher risk to have heart disease. Also, if your triglycerides are high, you can also have a high risk of heart disease. And if you have hypertension, we mean high blood pressure, that means that you have a higher risk. So what the doctors usually say, if you have three of those five, you have metabolic syndrome, meaning that you are in a high risk of having heart disease if you have one of the three. Why visceral fat? Because the visceral fat is the fat around the main organs, around the heart, around the stomach, around the intestine, and that's the fat that causes more disease, that causes more inflammation, that create chronic inflammation. Okay, that's why it is important for us to lose that weight right here in our belly fat. And then the insulin, because that diabetes is the main reason for heart disease. Hypertension, of course, you're exerting the tension into the arteries, that and also to the arteries that feed the heart. So of course it's going to cause heart disease. Okay, and then the triglycerides are the fat. If the blood is thick because of the fat that is flowing in the blood, like the blood samples that I sent you before, then the blood is not going to be able to flow normally, causing blockages and not able to take all the nutrients out of the that is flowing in the blood because of the thickness of the fat in it and stuff like that. So those are things that are very important, and we need to avoid having metabolic syndrome so that we lower our risk of heart disease. Okay, so how do I find out? Okay, look at the second part of this slide and make sure that you take a picture, okay, of it, so that you can have this information for you for later. So what are the ways that you know how are your inflammation levels, so that you can keep an eye on it? Okay, you can do different tests. You can do what is called the elevated high sensitive C-reactive protein. So the C-reactive protein test would show the doctor how much inflammation you have. Usually people that suffer or autoimmune disease, they usually get that test done regularly. But if you want to know what is your inflammation levels, you want to ask the doctor to please, can you run a C-reactive protein test? Okay. Another test that they can do also for inflammation is a set rate, and also levels of homocysteine also will let you know how much inflammation there's in your body. Another thing that can uh, you can test to know if you have inflammation is monocytes. If you have elevated monocytes, and the monocytes, the type of white blood cells. So when they do a complete blood count in CBC, okay, complete blood count, they can look at the monocytes, and if you see that your monocytes are high, you know that there's some inflammation going on in your body as well. Okay, so it's very important that you know what's going on in your body, so what are the measures that you have to take. If you have to adjust your lifestyle, if you need to adjust your nutrition, you can target what's going on in your body with your nutrition. It's very important that you know your numbers and that you keep records with it, okay, of it. And also, making sure that you're checking your triglycerides and your cholesterol and your high blood pressure and your sugar. Those are numbers that you need to know to make sure that if I'm in metabolic syndrome, then I have to tighten up my lifestyle. I need to tighten up my nutrition. I need to tighten up what I'm doing so that I can avoid heart disease. Okay? Okay. So how can we prevent heart disease? The first thing that you can do to prevent heart disease is eating no crap, meaning no eating no garbage. What means that? That's an acronym here. So no means eating no crap means no eating any carbonated drinks. That means no sodas. Remember what I always tell you: sodas is a whole bunch of chemicals, okay, with a ton of sugar that is not good for you. Then no refined foods. No refined foods means no refined carbs. That means no donuts and cookies and all those things that have flours and they have sugar, because the sugar is gonna raise your metabolic syndrome. It's gonna raise your insulin resistance. Okay, it's gonna make your body acidic. Okay, it's gonna make your blood thicker, and it's gonna create issues for your heart. So no refined sugars. And remember to read labels. Remember that when you are reading at the labels, the ingredients are in order of content. So if you see sugar in the first three ingredients, that means that particular item of food had that much sugar. And remember what I tell you before, that sugar have over 72 names. So you need to be familiar with those names. What I'm gonna do is that in Facebook, I'm gonna put the picture of the list of the names of sugar after the video, so you can see it. But you can Google that anyway, anywhere. And you can get the names of the sugar, so that way you know when you're reading the labels. Okay, it's very important. You want to avoid any artificial, the A is for artificial, any artificial flavors, artificial sugars, artificial colors, all the thing that is artificial. If it's not made out of, if God didn't made it, don't eat it. Okay, if God did not made it, don't eat it. You don't want nothing artificial. Those artificial colors cause ADHD. They're being related with carcinogens. They're being related to autism. Okay, the artificial sugars they're being related to uh, um, they've been related to cancer, and they're also being related to obesity, because people they eat more because, oh, that doesn't have sugar, but it have carbs. But like if you're having cookies that doesn't have sugar because they make it with Splenda or any other sugar, but you keep eating, yeah, you don't have the regular sugar, but you still have the carb from the flour and everything else that the thing is made of. So people eat more, causing more diabetes, even though they're eating something that doesn't have any sugar, apparently. So that's another thing that you have to make sure. Another thing that you want to make sure that you eat a lot of vegetables, a lot of low glycemic fruits, a lot of healthy fats. And remember, the healthy fats are olive oil, coconut oil, avocado oil. Okay, that you eat gluten-free grains, because you remember that gluten causes inflammation, and we want to lower all anything that causes inflammation. So you want to make sure that they said that the best diet for somebody that suffers heart disease is a vegan diet. The vegan diet is the best diet for somebody that suffers heart disease. The second choice for that will be a Mediterranean diet, or pescatarian, the people that is vegan but they eat fish because of the omega-3 in the fish that is really good for your heart. So that would be a good diet. Also, the Mediterranean diet is an excellent diet also for heart disease, or to prevent heart disease. And if you're trying to prevent, if you are finding that you are metabolic syndrome and you have an insulin resistant, then a good diet for the insulin resistant, just to make sure that you lower the insulin resistant and lower your sugar, will be a keto diet. That will be excellent for people that are fighting with the sugar levels. Okay. Then another thing that you want to do in order for you to reduce inflammation, you want to make sure you remove dairy, because you know that dairy can cause a lot of inflammation, plus cause a lot of mucus in your system. You want to remove all the trans fat, so no margarines, no vegetable oils. All the vegetable oils, we need a balance of omega-3 and omega-6, but all the vegetable oils like canola, sunflower, corn oil, all those like masola, all those things have too much omega-6, and omega-6 has been related to inflammation, increased inflammation. Too much omega-6 increases inflammation, plus the process that they go through to make those oils also cause inflammation. So no trans fat, no vegetable oils. Like I said, you're only going to use coconut oil, avocado oil, and olive oil. Okay, you want to eat meats that you want to avoid meats that are full of hormones and antibiotics. You want to eliminate any food that causes you allergies. Okay, or that you have light intolerance of them. You want to remove it. You want to remove gluten. You want to remove toxins. And when I mean remove toxins, not only the toxins in your food, you want to also eliminate the toxins in your beauty products and your personal care products, in the cleaning products that you use at home, in the air fresheners, in your detergent. I mean, reduce all type of toxin. You want to remove anything that is carcinogen. You want to reduce your stress, because remember how the Bible said that when they talk about your heart, they're talking about your mind. So when your mind is overloaded, when you are too weary, you are depressed, you are sad, all those things create an inflammation response into your body that also increase your oxidative stress. Okay, and all those things are going to be putting you in more risk for heart disease. So it's making sure that you control your stress. You also want to reduce the amount of salt and the amount of sugar that you use. You also want to stop smoking. What smoking does to the arteries is that harden the arteries. When they harden the arteries cannot flow the blood. They cannot contract and relax to pump to get the blood to flow. Also, increase your blood pressure, because the blood pressure is the pressure that the blood do to the walls of the arteries. Okay, and if the arteries cannot move properly, then they need to create more pressure to get the blood to move, and that's why your blood pressure high. So that's what smoking do to your heart and to your arteries. So you want to stop smoking, and you also want to stop alcohol, because alcohol also raises your blood pressure. and you don't want to have to do none of that. You want to manage stress, like I told you before. You want to do some exercise, and so cardiovascular exercise. And what are cardiovascular exercise? An exercise that will push your heart, to bit more and make your muscle of your heart stronger. So you want to do things like dancing and walking and the elliptical or bike, anything like that will, and I tell to everybody the main kind of exercise that you can do for cardiovascular exercise that is easy and you can do anywhere is walking. Hi, Miss Veronique. Walking is the best exercise that you can do because you can do it anywhere. That we suggest that everybody to accomplish 10,000 steps every day. Now, if you never walked before, you don't want to do that at the beginning, but every day you add up until you walk in 10,000 steps every day. Make sure that you count in the step from the minute that you put your foot down in the floor. You want to count those. So that's very important. Hi, Mr. Brian. So you can put the PowerPoint again. So those are the most things that you need to do. And you want to make sure that you know your numbers, like I said before. You want to make sure you know your cholesterol. You want to make sure that you know your inflammation markers, that you do an EKG to see how the song is the heart is working. Those are things that are very, very, very important that you do every year. You also want to add foods that are good for your heart. Those foods are like beets and turmeric and ginger and cinnamon and green tea. You want to add things that lower inflammation. You want to also make sure that your digestive system is working properly, because if the digestive system cannot absorb all the nutrients, then the nutrients are not going to get to the heart. So it's very important that you do that. If you are suffering high blood pressure, for example, you want to consume things like garlic and beets and hibiscus and tea. Take some Q10 and do some exercise. Those things will lower your blood pressure. You want to eat a variety of vegetables of all colors. I always tell people, try to have half of your vegetables raw and half of your vegetables cooked. Okay, and make sure that you create an alkaline environment to your body so that you can lower inflammation levels. Okay, so what are the most important supplements that you can use in order for you to avoid heart disease or to keep it at bay? I said to everybody to take magnesium, vitamin D, and you want to use vitamin D3, omega-3, and probiotics. And let me talk to you a little bit about each of them so you know why they're good. Okay, so magnesium. Magnesium ushers the calcium out of the cell. Without magnesium, that guard the calcium, then the calcium will accumulate in the arteries, creating rigidity and creating blockages in the arteries. So that's why magnesium is very important for your heart. There's different type of magnesium. They're all good for your heart, but the one that is best if you already suffer a heart disease is magnesium tartrate, and you want to take about 450 milligrams a day of magnesium tartrate. And I always tell people take magnesium in the evening. Okay. The next thing that you want to do is vitamin D3. Research says that shows that chronic heart failure is often linked to vitamin D3 deficiency. In fact, they said that vitamin D is connected to a great risk of death. When you have vitamin D deficiency, it connects you to a lot of a higher risk of death if you already suffer a heart failure. So make sure that you're taking vitamin D3. Now, when people now they starting the doctors are starting to check people on vitamin D levels, but what they do is that when they are deficiency, they're giving a prescription of vitamin D2, 50,000 international units once a week. What happened with vitamin D2 is that is synthetic, and the body cannot absorb it properly. But that's the only one they can prescribe and make, moolah with it. So that's why. So no, you want to have vitamin D3. So when you have to specify to the doctor that you want vitamin D3 because that's the one that the body can absorb, and it's very important that you take it. Okay. No, and this is just for heart disease. Vitamin D3 have all other functions that are essential for our body, that we really need it. And you know that we get vitamins D from the sun, but most of us are not out there taking sun properly. Then you have the winter months that you're not getting enough sun, and then the darker our skin is, the more time we're supposed to spend in the sun in order to make vitamin D3. So most of the African American and brown people, we all deficiency of vitamin D. So it's better to take a supplement on vitamin D3. Remember, no vitamin D2. You don't want the prescribed one. You got to specify to the doctor what you want, okay? The next thing that you really need also is the omega-3 that are good for heart and blood vessels, okay? It lower your triglycerides. It helps your body to reduce the risk of developing electrical issues, which mean arrhythmias. It slows the buildup of plaque, and also help you lower your blood pressure. You want to make sure that when you pick up your omega-3, is one that is picked up with a fish that they already checked that they have low mercury or no mercury, okay? And that when you look at the prescription in the back, they are high in EPA and DHA. If they have a little bit EPA and DHA, then you're not getting enough of the nutrients that you need in order to do the work that they need to do, okay? Then the next thing that you need to get is probiotics. Remember that I talked to you before, I mentioned before that if your intestine and your digestive system is not working correctly, you're not going to be able to get all the nutrients that the body needs. But also probiotics not only good to make sure that your system, the digestive system, working fine, and it's not only part of the immune system, but they also help with heart disease. Okay, it says here that they prevent cholesterol from being absorbed. They also reduce your blood pressure. And what is it here? Yeah, and they even reduce the C-reactive protein, means that it reduces the level of inflammation. So it's very important for us to take good probiotics in a daily basis. Now I have one more thing that I forgot to put in when I put the slide with all the supplements, is CoQ10. CoQ10 is a substance that helps convert food into energy. CoQ10 is found in almost every cell in our body, and it's a powerful antioxidant. It's an antioxidant that finds damaging particles in the body known as free radicals, which damage the cell membrane, tamper with DNA, and even cause sex death. So CoQ10 is good for the energy, and also it helps clean up the cells of the free radicals, meaning reducing the oxidative stress, reducing the inflammation. Okay, so patients that are diagnosed with congestive heart failure have been shown to have low levels of CoQ10. So having the CoQ10 will help them reverse the heart failure. So I want to talk to you about CoQ10, especially when it comes to cholesterol, because nowadays there's a trend that you have high cholesterol, they give you a statin, meaning a cholesterol lower medication. And the one thing that medication do is to stop the production of CoQ10. Now remember that CoQ10 is made by our bodies. Our bodies that make CoQ10. Okay, so when you take the supplement, it helps, but it's never the same as the one that God gave us. Okay, it never works the same as the one that God gave us. But if you are taking a cholesterol medication, make sure that you're taking CoQ10 together. If you're not taking CoQ10 together, that's the reason why you got muscle aches, you have no energy, you have fatigue, because you are not producing any CoQ10. Then you get more inflamed. You already suffer any pains and joint pains. You're going to have more because you're not having enough CoQ10. Not only that, the cholesterol medication have been linked to diabetes and insulin resistance. It's been linked to Alzheimer's. Okay? So when the doctor tells you that they're going to put you in a statin, you have to really, really, really study if you really need that statin. Usually when you go to the doctor and you say, they check your cholesterol, they check your total cholesterol, and then they check, they do a lipid profile that they check your total cholesterol, your total triglycerides, and then good cholesterol and bad cholesterol. Okay? But you want them, when you ask the doctor, you tell them, doctor, I want the lipid profile with particle size. With particle size. What that means, particle size? That means that they take the bad cholesterol, okay, and they check the size of the particles, because what happens is that when you have small particles of bad cholesterol, that's the one that stick into the cell walls and cause the blockages in the arteries. Okay, the small particle, but the big particles are not able to stick, so they don't cause the blockages. So when you do all that, let's say for a sake of explaining here, let's say you have a high cholesterol that is 220, it's high. But when they do the division into good and bad cholesterol, you have more bad cholesterol. But then when they do the particle size, your particles are all big. Then you don't need really the cholesterol medication, because those particles are not going to stick. Doing a diet that is low in cholesterol, having all the other things that I talk about that are going to lower your cholesterol will be good enough. Okay, You only want to take it if you have more small particles. If your good cholesterol is low, then you want to take it, and you want to take it for a period of time, not forever, just to lower your cholesterol and then continue with diet. Because like I said, if you notice, every single since they started the cholesterol medication, there's more people with Alzheimer's. Why? Because remember that 60% of your brain cells is made out of cholesterol, it's made out of fat. So now you're lowering the cholesterol so bad that not enough fat is getting into the brain. That's why people are suffering of degenerative nerve diseases like Parkinson, Alzheimer's, and dementias, because of so many cholesterol. A lot of people uh, didn't have no heart disease whatsoever. Okay, and now they just have the high cholesterol. They give them the cholesterol medication, and if you saw in the slide, okay, when you don't have enough CoQ10, and they didn't tell them nothing about the CoQ10, it can cause heart failure. Why? Because remember that the CoQ10 give the energy to the muscle, and now the muscle doesn't have the energy. Now the muscle are not going to have the energy to contract and take the blood all over the body. So those are the issues that are going to happen if you are not if you are taking the medication when you really don't need it. So what's going on is that they every so many years they make the range, shorter and shorter. Oh, you need to start the medication if they have only 170 of. It used to be that you needed to have 220 of cholesterol to get a statin. Then they lower it to 200. Now they put it into 180. Then they change it to 170. Because the more people they can get, the more money they can get when you really don't need it. Not to mention that because of the lack of CoQ10, also cause rhabdomyolysis. I mean, breakage of the muscle cells, causing a lot of pain, and that can cause kidney failure and different things. So please, please, please make sure that you ask the doctor exactly what you need. Remember what I always tell you, that we need to take care of ourselves so that we can do the job that God has for us, so that we can continue to spread the kingdom of God everywhere we go. If we're not healthy, if we're not taking care of our heart, we're not going to be able to do this, okay? And remember that the doctor is responsible for your sick care, but you, yes, you are responsible for your heart, for your health care. Okay, so take care, and I see you later. Bye.